Sarbhan Singh from University Malaya, UM.
Yes, what you, yes. Life is a journey filled with ups and downs. For me, growing up as a teenager, it was a fun and enjoyable experience. Unfortunately, I can't say the same about many adolescents today who suffer from depression. Depression is a common mental health disorder which is on the rise and affects millions of adolescents worldwide. In Malaysia, 1 in 5 adolescents suffer from depression, and only 20% actually reach out for help. More concerningly, depression during the adolescent period increases the risk of suicide, substance abuse, and developmental impairment. Could mental health literacy be a possible solution for this problem? Well, mental health literacy is a concept that has been around for more than 2 decades now. Individuals with adequate levels of mental health literacy are better able to correctly recognize a mental health disorder early on, seek more appropriate sources of help, as well as demonstrate fewer stigmatizing attitudes towards mental health disorder. Therefore, I examined if mental health literacy is able to reduce depression among adolescents. To answer my research question, 1,800 adolescents were assessed for symptoms of depression as well as their understanding of mental health literacy in a survey conducted over a period of 6 months. So what did I find? 80% of adolescents had an intention to seek help if they faced a problem. Now that's good. But only 3% were able to recognize that problem as depression. This therefore translates to a high possibilities of these adolescents seeking inappropriate sources of help due to the underlying failure to recognize depression. More concerningly, majority of the adolescents were classified as having inadequate levels of mental health literacy, and those with inadequate levels of mental health literacy had an increased risk of having depression. So where do we go from here? My findings strongly suggest that there is an urgent need to increase the level of understanding and awareness of mental health literacy among adolescents. And this can be achieved by integrating the concept of mental health literacy into the school education, something which is very important but currently lacking. This initiative would enable adolescents to better pick up the early signs and symptoms of depression, therefore promoting more positive help-seeking intention, attitudes and behaviors. With that said, let's focus on improving mental health literacy so that we can reduce depression and save young lives. Thank you.
Question and answer from the judges. Alright, thank you very much. Now let us listen to our last finalist for Science and Technology category, Eileen